Now, I bring you the moment that had me and my sister cackling so hard we drew attention to ourselves. A device that we had thought looked suspiciously like a floor sander. The placard read, "Early 20th century medical vibrator, used by doctors to treat female hysteria, invented when the doctor's hands got tired." Sir, let me repeat. He got tired of using his hands, so he built a machine to do the job. Such a gentleman. The Victorian solution to a very modern problem. Sidebar, hysteria was a diagnosis for women who were a bit too much. Female hysteria was a catch-all diagnosis for women exhibiting anything from anxiety to insomnia to sexual desire and irritability. In other words, they had emotions. This very serious condition dates back to ancient Greece, where it was thought the uterus could roam the body, causing trouble. By the 19th century, hysteria was still being treated as a legitimate medical issue, one conveniently requiring frequent, intimate attention from male physicians. The treatment often involved what they called pelvic massage, to orgasm, which doctors called hysterical paroxysm. As I mentioned earlier, medical vibrators weren't invented for patient pleasure. They were created because doctors' hands and fingers got tired from performing the treatment manually. This is efficiency meeting Victorian awkwardness. I just keep thinking about her. Some housewife in a corset and ankle boots leaving her home. Maybe she just finished boiling laundry or wrangling 4 children. And she walks to the doctor's office for her regularly scheduled pelvic massage by her family physician, with whom she probably made small talk. Like, "How's your wife?" "Oh, she's well." "All right, scoot down. We're going to relieve your nerves today." And this wasn't scandalous. It was treatment. Prescribed, clinical, routine. All the intimacy, none of the context. Just another Tuesday, I suppose. And what's the conversation like when she gets home? She's setting the dinner table, her husband's reading the paper, and he says, "How was your appointment?" And she's like, "Oh, fine. Dr. Whitman says my uterus has been pacified. Pass the potatoes." Or worse, maybe he doesn't even ask. Maybe he just accepted that his wife is spending every other week getting medically recalibrated. And maybe even tips his hat the next time he sees the doctor at church, like, "Much obliged for keeping Margaret's nerves in check, old chap."